And now we are live. TikTok Live number 86 now. We're up to TikTok Live number 86. First questions in the chat. Guys, by the way, for the top 5 listeners to stay on the TikTok Live, I give you guys a shout out in the caption on YouTube, podcast, and all platforms. That'll be posting the full-length version, all right? Okay, so first question asked was, well, first thing was Issa996 said, what's up? So what's up, Issa? B said DAT scheduled for May 16th. So excellent. Congrats, B. You got 6 months to study for that, being that it's November right now. That's pretty good. Isaac said, current D2, got 13 finals in the next 8 school days. Any advice? Yeah, sounds like you need to be studying, Isaac. Maybe you need to get back to the study table, the desk right now and study. That's a lot. That's 13 finals is a lot. I mean, back to what I say in the beginning is Quizlet. You know, if you have your Quizlets down and ready to go by now it's just Quizlet repetitions. You know, doing the Quizlet on the treadmill, doing the Quizlet on a walk, doing the Quizlet at your desk, doing the Quizlet in classes, doing the Quizlet. I usually have Grok read out the Quizlet questions to me in the car. So I'm studying in the car while I'm driving to work. You could be doing that while you drive to school. So it's about finding different ways. You know, you could do it on the spin bike. You could do it on the treadmill, things like that. You know what I mean? Khalil Tam said, what's up? What's up, Khalil? Hyde said, is it possible for my 9 months sinus infection came up from my wisdom tooth removal? Yeah, it is possible. That is possible that it came, but your upper wisdom tooth, yeah. Your upper wisdom tooth could cause that, but 9 months, oh, you mean it lasted 9 months? Yeah, it could be, unfortunately. Once the bacteria get in there, they like to just sit in there and fester and cause that sinusitis. You know what I mean? Hopefully you got some Augmentin. Augmentin is generally, not medical advice, Augmentin is generally a good antibiotic that we prescribe for sinuses, for sinus infections, sinus, oral enteral communications, if that's what happened during your extraction. The upper wisdom teeth, if they're very high up, they could be very close to the sinus, maybe a thin little millimeter thick wall in between the tooth and the sinus, the maxillary sinus. And so if there was a little communication in between your wisdom tooth and the sinus, that could cause sinusitis and other sinus symptoms. All right, so keep that in mind. Issa996, check my question. What question? You didn't have a question here. Where's your question? C. Benji said, how long did you study for the DAT? I'm going to take it this summer. I studied a month and a half. I wouldn't recommend that. I would recommend taking as much time as you need to study for it. I think a month and a half might be a little bit crunched. I'd probably look at more like 2 to 3 months of studying for that DAT. I think that's a better idea than crunching it all, because I graduated middle to end of May, and then immediately I started studying for that DAT. So, and I took the DAT the 21st of July. So maybe it was 2 months I had to study for it. I still think longer would have been better, maybe 3 months. So, C. Benji, I think maybe 3 months, consider that. Hyde said 3 weeks of Keflex. Yeah, but does Keflex have good sinus coverage? I don't think so. Keflex is really good for skin, like skin flora, but Augmentin is generally better for sinus coverage from my training. That's what I learned. That's my understanding. User 7214, December 15th needs to come way faster. Why? What's December 15th? VS Vishna said, what are your hours like now that you're done with residency? Monday through Friday, 9 to 5. Fridays are 8 to 4 right now. I'd like to switch all the days to 8 to 4, but hopefully after my boards exam in February, that I could start to implement those changes. I'd really like to. It would help out my day-to-day a lot. That would be very helpful if I could switch up my schedule a bit there. You know what I mean? Well, let me explain why. Because right now I like the 9 to 5 because I do try and get at least an hour of studying in before work. After work, it's very hard to find time, to find the focus, because you're at the end of the day, you're fatigued. I'm usually okay at the end of the day, but finding the time to study, because things come up throughout the day. Things come up at the end of the day. Finding the time to study, if you just wait till the end of the day every day, it might not ever come. So I like to get in at least an hour in before going into work. And so 9 to 5 is good. But if I was to inch it up to 8 to 4, I wouldn't have any time to study in the mornings. You know what I mean? So I'm going to wait for that till after the boards. But I do think 8 to 4 is a better schedule for me, at least the way my life goes right now. So I'm hoping to adjust it after that. I got to see what the assistants can do, if they agree with that. Warren said, man, I'm on my 3rd day after wisdom tooth removal, after my molar tooth removed. It's hell. Yeah, days 2 and 3, the swelling's going to be at a maximum. So many times the pressure and pain after that wisdom tooth removal is worse on 2nd and 3rd days. After that, after day 3, it should get better. If it doesn't get better, you might have a dry socket. That's something to think about, okay? If you're still feeling significant pain, maybe increased pain from days 3 to 5, you probably have a dry socket. I would visit the dentist or oral surgeon that removed your wisdom teeth. Hopefully an oral surgeon. Jfcjd, what's up, man? How are you doing? December 15th is when your first round of acceptances come out for those who have interviewed. Okay. Okay, for dental school. December 15th is dental school decision day. December 15th. It used to be like December 2nd or 3rd. It was December 2nd when I applied. I guess they kicked it back half a month. That's too bad. Maybe it gives them more time to interview. I guess that's maybe has to do it a little bit. Underscore dot underscore dot s. Did you apply to dental school the year after graduating? Yeah, I applied the year after graduating. I took one gap year, studied for the DAT first, got that out of the way, and then I applied and went from there. Yeah, I took a gap year. I worked like 2 different lifeguarding jobs. One weekday nights at the gym. One it was like Friday and Saturdays at an assisted living home, or Fridays and Sundays it might have been, and then Monday through Thursday or Monday through Friday, I was working at an oral surgery practice as a surgical assistant. That was my gap year, reading books, listening to podcasts, doing music producing. It was a great year. Yeah. Carissa said, what's up, Carissa? Do you have any podcast guests lined up? I do. I have Dr. Jackie. She's an oral surgeon. She's lined up. I got Dr. Ryan Davis. He's a general dentist in Port Jefferson out here on Long Island. He's lined up. I also have Dr. Robert Reddy tomorrow night. He's one of the 2 main authors and editors of the Oral Surgery Oral Boards Exam Review book that I'm studying primarily from. So he's on tomorrow. It's pretty awesome. He's also at the St. Louis Boards Review course. So that's something to consider too. I also have someone else lined up who's on that too. Who else is coming? I'll tell you right now. Hold on. Let me go through this right now. Who else do I have lined up for the podcast? Wednesday is Dr. Jackie, Dr. Ryan Davis, Robert Reddy is tomorrow night. Hopefully, Dr. Joe Pantaleo. He's a general dentist out here on Long Island. I'm trying to get him on the podcast right now. I have dinner with him Thursday. In 2 weeks, on the 8th, December 8th, I have Dr. Dan Holtzclaw. And then the 9th, Dr. Alex Newen again for part 2 with him. Dr. Tamika Anoya, general dentist podcast. She's going to be on the 9th. She's a general dentist here in like West Babylon, Lindenhurst area. Who else do I got? I got the Back Teeth Boys in January. We took a little break, just pushed that back to January because Dr. Wahand, Serv Wahand, his son, has been getting numerous surgeries. Unfortunately, and hoping that he's doing well. So we're giving him some time so that we could get all the guys back on the episode there. And then we have Oral Path Trivia Night on the 13th of January. I think this will be it for right now. I might add on 1 or 2 more in December, maybe, but I really need to crack down on these last 2 months of studying. I need more time studying the weekdays and stuff. So I'm going to be doing that. So, and then I have a Columbia Dental School event, but that's April next year. So that's what I got right now. All booked out. So there you go, Carissa. That's who we got. Carissa, who do you want me to get on the podcast? Who can I interview or chat with on the podcast that you'd be interested in me having on? Can you let me know, Carissa? Because I could tailor this to you. You know what I mean? I think that would be nice. If you'd like that, I could do that. All right, let's continue. HYD said, I'm allergic to penicillin and my cultures were clindamycin resistant. I should have mentioned that. That clears everything up. Yes, you cannot take Augmentin if you have an allergy to penicillin, amoxicillin, and so on. The penicillin families, Augmentin is a combination between amoxicillin and clavulanic acid. Clavulanic acid, it's like a defense covering, almost like a helmet, if you will, for that bacteria, and it increases the properties of Augmentin, but nonetheless, it is amoxicillin, which is a derivative of penicillin. So if you're allergic to penicillin, you can't have Augmentin or amoxicillin and such. So cultures were clindamycin resistant, so obviously you couldn't do clindamycin. So yeah, Keflix sounds to be pretty good alternative. Curious, what about doxycycline? What did they say about that? Vishna said, do you work at a hospital or private practice? I'm in a private practice. Yeah, Monday through Friday at All County Oral Surgery. That's where I'm at. No, I got the hat over there. You can see the logo of it. Shoot. I had it on the last podcast, the last TikTok Live. But yeah, I'm out here at All County in the Melville office, Monday through Friday of All County Oral Surgery. Yeah. Dr. Ross Shavkin, he's my boss. So I'm excited to be out there. I'm 3 months in, actually. I'm 3 months in come the 2nd of December. So Tuesday, I'm a full quarter in 3 months. And it's going well. Yeah, I was nervous about starting to do sedations, and I'm not anymore. It's been going great. I really enjoy it. Sedations are really good. I get in a nice controlled setting. It's been going really good. So far so good, knock on wood. Let's see. Jfcjdbddj. It's just a bunch of Jfcjdbddj. Hi, mate. I'm a dentist from the UK who loves oral surgery. How are you doing? Love watching your videos. Thanks. I'm doing good. I'm doing all dental alveolar surgeries right now in the practice. I'm still waiting on hospital privileges. I need to reach out to them about that, see what's going on there. And yeah, how are you doing in the UK? Thanks for coming on, man. C. Benji said, do you guys do a lot of full arch cases? My boss does. I haven't done any full arch cases. I got a couple patients who would be great candidates for it, but finances come into the play there. Yeah. So yeah, the finances could really change, what you can and can't do in the office, unfortunately. But yeah, I'm ready to go. I've done a lot of full arch cases in residency, so I'm ready to go. Cody said, do you still think dental school is worth it with how much schooling costs? For many it is. For some, it might not be worth it. I don't know where you fit in that, Cody. It's very important to look into and figure out. But generally, I think dentistry is a very great profession. I really do. The key is you got to get towards partnership or ownership. I really think that's the key, because I just met with another general dentist last Monday, and he was telling me how he would get phone calls from the DSO asking like, yeah, so why didn't you do a crown on this patient? Why didn't you end up doing the extraction or whatever it was? That's not cool. He said they would call him on his day off and then call and talk to him about that. But it's like, it's your day off, so you're not paying for this day. And then they'd ask intrusive questions for treatment planning. And it's like, because the patient wasn't a candidate for that, or yada, yada. Trying to get him to upsell treatment cases. So it's unfortunate because general dentists have to face that. Yeah, so I think ownership or partnership within your own organization, so you can dictate certain treatment planning and keep it ethical. Remember, the dentists take an ethical oath. The owners of DSOs, if it's a business guy, they don't take an oath. They don't take an ethical oath for patient care. So that's something really important to consider. If you're into that stuff, I am. And I consider that very highly, So _._.s. What study method for dental school coursework allowed you to make room for the CBSE? It was Quizlet. I just put up the post, I think yesterday or today, about that. It's Quizlet, getting the repetitions in a Quizlet and adding figures. And I have AI, so you can get it into Quizlet. I had to make all the Quizlet cards by scratch on my own. You could just implement all PowerPoint into ChatGPT or something, or Grok, and it'll give you those question answers that you could just copy and paste into Quizlet. So in 5 minutes, you could do what would take me 5 hours. Yeah, that's really important. So Quizlet repetitions, that would be what I suggest doing. That's what I did. So LT said, how often do you see dental anesthesiologists? I don't see dental anesthesiologists often at all. B said, Owen Hunt. I Huff Freon said, buddy threw shoulder out of socket applying hemorrhoid cream. Am I wrong for laughing? What? What are you talking about? What? Where'd that come from? Omar said, can you do wisdom teeth / implant cases review, and how do you approach it clinically? I could. I would do wisdom tooth cases, but that would be a HIPAA thing, and everyone's trying to catch people with HIPAA nowadays. So how would the layout be so I could do that safely? And maybe I could do that as in a mentoring session. I could do that. Carissa said, awesome. I've been watching your YouTube videos, interviews, and podcasts. I really enjoy it. Thanks, Carissa. And who would you want? Give me some ideas. I'll see if I can get them in December. Manny said, what are you studying for? I'm studying for the oral maxillofacial surgery part 2 boards, which is the oral exam. So it's sitting across the table from several oral surgeons, and they quiz you. They test you based on, like, verbally, and you have to answer verbally. There's nothing written. No, it's a very difficult exam, and so it's a lot to prepare for. I got 2 months left, but I need to do a lot more. CJD said, finished your video with Dr. Qureshi. Great listen. Thanks, man. Excited for part 2 with Dr. Nguyen. Yeah. I'll let him know that. I'm going to screenshot this right now. Man. I'm going to let him know that you were looking forward to it. Sweet. Thank you, man. Thanks. And Carissa, you gotta let me know. You gotta let me know who you want me to get on the podcast, and I'll reach out. HOE said, do you know any international dentists that applied to OMFS after doing advanced standing program? International dentists that applied after an event? Yes, I think so. I do. They were from Canada. Though. Yes. Jacob Doaga said, do you work in a private practice? Yeah, I'm at All County, in the Melville office of All County Oral Surgery in Melville. Yeah. So Omar said, what is the podcast? The podcast is, you could look it up, Dr. Gallagher's podcast. You could look up Dose of Dental podcast or Long Island Dentist podcast. Those are the dentistry ones that I'm in now. Ethan Lee said, what's your favorite dermatome? I don't know. My favorite instrument right now is the spade elevator. I like that. And sometimes the crane pick elevator. It's really it. Yeah, root tip pick if you get to that point. Yeah. Oh, we got some comments that were filtered to protect the community's experience. Interesting. Experience. Julian said, how do you deal with patients with bad breath? Oh, I try to ignore it if I can. I mean, if you think about it, I'm taking out hopeless teeth all day. So, non-restorable teeth all day. So they're all pretty bad. I'm almost desensitized to it at this point. I don't think my nose can smell anything anymore. That's why I lost all my eyebrows. It's that breath that I got to do. No, I'm kidding. I'm kidding. Frank Rosado said, do you feel like dentistry has come to a point where it feels very corporate-like? I do. Yes, I do. And I don't like it. _._.s said, are you accepting undergrad students shadowing you? Yes, I am. I'm doing shadowing after I finish boards in February, though. After February, come on in. Come on and take a look. Say hello. Let's do it. Let's plan a day. Jfcjdbddj said, hey, doc, does Dr. Chapman allow for shadowers for full arch cases? I'm a pre-dent. I don't know. I'm sure he does. But I don't know. I actually haven't asked him about that. I'll have to ask him. That's a great question. Olivia Kinsey, 2000, said, how do you help with dental anxiety and dental phobia? A couple things. I over communicate everything I do unless someone says, don't tell me anything, right? So I always ask questions. I triple check, double to triple check everything before we even start the surgery. So I make sure everyone's numb, completely numb before we start. And I'm always asking questions throughout the case. I show you the instruments we're going to use. I make sure that we're not going to rush through things. We're going to take our time. Again, triple check. Make sure you're numb before doing any actual surgery steps and things like that. Otherwise, if it's really that bad, we could always upgrade a case to sedation, IV sedation if we need to. If nitrous fails, we have IV sedation. If you don't want IV sedation, but you want something more than local, we could do nitrous oxide. That's the laughing gas. So there's different levels of things that we could do to mitigate the problems of dental anxiety and dental phobia. I want patients to be comfortable in the operatoire. You know what I mean? So I always set that kind of expectation of, if you need more, we could always upgrade to nitrous or IV sedation, unless you just want that off the bat and you're a candidate for it, good airway, not too complex medical history, stuff like that. The dental student said, hey, Brent, what's up, Luke? It's been an officially final season. Yes, it is final season right now. How are your finals going? You got anything planned for over break? When is your break? How many finals do you have left right now? Cody said, what made you choose dentistry? I'm getting ready to shadow a dentist soon. Dentistry I like because all the dentists that were my mentors that I shadowed, they own their own practices and they were very, very, very happy. That was really it. I met my mentors who were general dentists and an oral surgeon at the gym, and they were so awesome, motivating, inspiring, and always had a good attitude. I went in and chatted them. They were so welcoming. The doctors I knew, none of them were as enthusiastic or happy. Like, they all said, don't choose medicine. It's over. It's not going in the right direction and everything. And so that's why I went dentistry, and everything had checked out. But now dentistry is starting to go very corporate the way medicine did. And now I'm starting to see changes where dentists are starting to say the same things that the medical doctors started to say 20 years ago. It's concerning. But, that's how it goes sometimes. The dentists at the top, they're cashing out. It's hard to find someone it's hard to find a dentist who's willing to add on an associate for sweat equity buy-in, where you work for the general dentist and then the ownership of the practice slowly kind of changes over as you earn and pay that dentist. And then also it's hard to find associates that can do that are the right fit, that have money to pay forward for practice ownership. So it's a tough gap right now, because dentists are coming out there in so much debt generally. So it's a big gap right now. And amidst all that, the general dentists who the dental practice owners, they're just cashing out. They're selling to DSOs, taking the money and leaving, unfortunately. And that's tough, because it's leaving young dentists and dental students with much fewer options, much fewer opportunities for ownership and partnership for the future. So it's going to be interesting to see what happens. Chene Kiki Chicken said, I'm on the fence between CRNA and RN versus dentist. Which one do you recommend more? Well, I can't recommend. I don't know what you like more. It's not just like pig nursing or dentist. It doesn't work that way. You need to get exposure to all of those. You need exposure what RNs do. You need to see what CRNAs do in the operating room, doing anesthesia in the hospital. I think it's an excellent option versus dentists in your area. Could you see yourself doing what the dentists that you have shadowed do? That's what you need to figure out. Zachary Todd said, what kind of surgical drill do you use? In residency, we use a straight handpiece, and then we use a contra angle in private practice right now. So that's what we're using. That's what I use to take away bone, draw, section teeth, apicoectomy, stuff like that. Zachary Todd said, why is it frowned upon to elevate from the lingual approach? There's a couple things. What if the elevator slips and goes into the floor of the mouth? There's a lot of anatomy over there. Okay. What if the lingual plate fractures off, which, because it's thin on that side. It's generally very thin on that side. You fracture that lingual plate off, and then that causes necrosis. You're in trouble. That's not good. Yeah, it's generally because anatomy on the lingual side, the bone could fracture, things like that. It's like difficult to get your elevator on the lingual side. That's like a difficult spot to get to. Change said best OMFS surgeon for aesthetics, obstructive sleep apnea, Wallline, Gunson. I don't know who Wallline or Gunson are, but I would say for aesthetics, I mean, you have cosmetic surgeons. You have Ryan Diepenbrock in Indiana. You have Dr. Qureshi in Ohio. You have Dr. Todd Hanna here in Manhattan, New York. He's doing predominantly cosmetics and aesthetics. Obstructive sleep apnea, though, I mean, that would be any oral surgeon who does orthognathic surgery and sleep apnea. You could look at Dr. Alex. Yeah, I mean, yeah, there's a lot of places you can go. User 3249. Listened to your advice and studied at a coffee place without my phone. Scored a 93% on my OSCE. Good stuff, man. It works, right? It's good work. Good stuff. I'm glad that worked out for you, man. Yeah, let's get a good score on the next test. All right. And noise canceling headphones also, right? Because that could be really distracting. I know. Next question is Zachary Todd. Can you still use propofol on someone with egg allergy? I wouldn't risk it. User 72, but good question. User 721418. What made you pick OMFS over something like perio, given a lot of overlap in private practice? If things go wrong in your periodontist, where they go? They go to the hospital, and who's seeing them at the hospital? Probably an oral surgeon. I didn't want that I wanted to manage all my own complications. Then you could be like, oh, periodontists manage their own complications. Yeah, some of them do. Yeah. I wanted to do oral surgery. There's other things, the overlap I love, but I also love the things that don't overlap. I think it's important and I enjoy them. Issa996 said, how do you become better in presentations? Practice, really practice. Go on a TikTok live and present. Watch that. Go on a TikTok live and present your presentation. You're going to get made fun of like you wouldn't believe. And that's how you get good at doing presentations. Because some people are going to listen. They're going to ask you questions about the presentation. Do it. Learn what questions they want to ask. And now you're going to know what to expect when they ask you that when you're giving your presentation in class, right? So that would be my recommendation. Give it a shot. Zachary Todd said, can you still use... Oh, I answered that. The dental student, Luke, what's up, man? 2 more weeks. Completed my last block of gross anatomy. Congrats. But still have the rest of my finals. Okay. So yeah, you got a ways to go. And I hope you get a little break. You get a little break for yourself to enjoy, and catch up on sleep and, good food with the family. Luke also said, how is private practice going? It's going good. I think it's going really good. I like doing sedations, dental velar, wisdom teeth. Everything I've been doing, I enjoy doing it. And I enjoy the team I'm with right now. It's great. So yeah, I got what, 9, I got, 2 years of my contract left. So it's good. Almost 2 years. You get what I'm saying. Bam02 said, is 1 to 2 millimeters generalized bone loss at age 31 bad? I would work on reversing that or protecting that as much as you can, figure out what the generalized bone loss is from. But 1 to 2 at age 31 is probably pretty normal. 1 to 2 millimeters of bone loss isn't that bad. Once you get into that 3 zone, over 2 to 3, once you get over that, that's pretty tough. Work with your dentist to reverse that, right? See what you can do. See what measures you can do. Dominic, I want to specialize in OMFS down the road. Any tips and tricks for studying in dental school and residency? Yep, Quizlet. I'm going to say it again, Quizlet, Dominic. Use AI to put in PDFs of the chapters, the PowerPoints, and then ask it to summarize all the information and then put it into a question and answer format for you to copy and paste directly into Quizlet and study it from there. That's the trick, all right? Kellen says, Jesus loves you. Sweet. Thanks, man. Amen to that. Nicole said, IPSA, if you are in countries that pay well, question mark. IPSA said, is going to dental school for the money worth it? Going into anything for just money is not worth it. Nope. So there's your answer. Got to go into things that you like it. You got to pick careers that you're going to be excited to be doing every single day, in and out, on and on and on and on. It's so important, guys. Don't overlook that. IPSA said, what if I want to live in a big city like New York City or Chicago, that you actually make less money in high populated areas? I don't know if anyone told you that before, but yeah, in dentistry, you make less money in high populated areas. There you go. There you know. Joey, aka Homelander, said, my wisdom tooth is decayed down to my root. Will it be as bad or as hard of a tooth to pull? It might be. It really depends. Because sometimes, say, for example, if it was previously treated with a root canal treatment, then, oh man, that tooth is most likely just going to keep breaking and breaking and breaking down. Otherwise, if it just broke down there because the crown fractured off, or you had a crown there recently and it's a relatively healthy root, that might just be able to be wiggled out. You know what I mean? It could go two different ways. The intelligent gut said, "What's the topic about? Topic about of what? What's the topic about of what?" Intelligent gut. Nicole said, "Really? LOL. Really, Nicole." Dominic said, "Appreciate the help. Much love, brother. You were a great speaker." Oh, thanks, Dominic. I appreciate that. Very kind of you. Bamo2 said, "Can I still get orthodontic surgery with 1 to 2 millimeters of loss?" But the 1 to 2 millimeters of generalized bone loss is around your teeth, right? That's in dental-alveolar areas. That doesn't necessarily relate to getting orthodontic surgery, right? If you are a candidate for orthodontic surgery, that's something completely different. But yeah, it's unrelated. So you should be in a go there if you need it. Cody said, "What is your opinion on dentists owning multiple practices?" I think only dentists should own multiple practices. I don't think the ADA should be letting anyone who's not a dentist own a dental practice, and that's very important. And they're looking the other way at these things. It's not good. Yeah, only dentists should be owning practices. They want to own multiple practices. Good for them. I think we should incentivize it. I think they should do that. And if they do a good job at it and they partner with other dentists, it spreads the wealth. Like, and wealth isn't necessarily financial means. Wealth could be time. Wealth could literally be like you work 3 days a week. I consider that wealth. If you could work 3 days a week and support your lifestyle, live within your means, and you have 5 days, that would be 4 days off a week, you're winning in life. You are winning. Like, no one's really talking about that. Everyone just thinks money, money. No. If you're working 3 days a week, you are extremely wealthy in my book because you have 4 days off to your friends, to your family, to travel. Are you kidding me? That's the goal. Does anyone disagree with that on the live right now? Like, let me know. Like, question that. Come on, let's throw it out there. I will back that up. I will die on this hill. Cody said, "What is your opinion?" Oh, I said that. Aska ran Walia 599. About to enter my first year of dental school. Any advice? Yep. Right off the bat, learn effective and efficient studying. Okay, effective studying is working your way up from C's, B's to A's, but efficient studying is maintaining those A's and studying for it less and less and less because it's the equivalent of 32 credits a semester. Dental school, it is. Be ready for that. Be ready for that. Okay, when you start. The way I figured out the efficient studying was Quizlet. Okay, I talked about that a lot on this live. Guys, I'm recording the live, by the way. This is TikTok Live number 86. If you want to look it up later and listen to it, I'm putting it up on the podcast, YouTube channel, and the top 5 listeners, you guys who've been on the longest, the top 5, I'm giving you guys a shout out in the caption. So, yeah, you can listen to it later if you need, all right? Jack Purse said, "How to shine on my residency interviews I have coming up right now." It's just a conversation. That's how you shine. You shine by being yourself, being unique, letting your hobbies shine through, talk about things that you like, know your resume and your application in and out. Be ready and willing to talk about your low points and be ready to talk about be humble talking about your high points. Okay, make sure that you know how to twist anything negative into a positive on your resume. All these things are very important. Okay. Carissa said, "Amen." Thanks, Carissa. Yeah, Carissa, come on. Let me know who you want me to get on the podcast. I'll fit in for you, Carissa. I'm gonna fit in one more person this December. If you give me a name, I'll contact them right after this. I'll ask them. I'll say that they got a shout out, and you want them on the podcast, and I'll ask them to come on. So let me know. Let me know, Carissa. Joey, aka Homelander, said, "No root canal, no crown. It just fell apart. No pain. It's just beneath my gum." It's hard. It's hard. No root canal. So you got a chance there. It might just be able to be wiggled right out. I don't know. I can't tell you exactly how it's going to go without looking at x-rays, and even x-rays sometimes can't portray, you know what I mean? I don't know your age and the history of that tooth, what it went through. Jack Purr said, "Oh, I just saw you have a video on this you just made." Yep. Yes, I do. Cac Purr. Yeah, let me know. J Wills 927 said, "Honest opinion of root canal treatment. I work with an oral surgeon, and most teeth we extract / place an immediate implant are root canal treated." Yeah. What's my opinion on root canal treatment? I mean, I think it's a good option to save teeth. But once you're doing your second or third root canal, like revision, at that point, it's like, you know what I mean? At second or third try, there's a very low percentage that those end up working out long term. Just saying. But if first try and it goes really well, yeah, I think it's a great idea. I think it's a great option to try and save those teeth. Okay. Ethan said, "I'm interested in medicine. Do I do pre-med or pre-dental? I'm interested in owning a practice." Aren't we all? Ethan, like, you need to figure out, do you like medicine or dentistry more to do day in and day out? You're not just going to walk into dentistry and own a practice. All right? Or maybe you have like millions and millions of dollars and you can do that. Well, that's different. I don't have the answer for you if that's the way. Also, I wouldn't work at a practice unless like the boss is like good and like experienced and knows how to lead a good team and give you personalized mentorship and vision and goal and shows you the pathway to hitting your goals. You know what I mean? When was the last time your mentor sat down and asked you, so what's your goal the next 5 years, 10 years, 20 years? And how are we going to work together to get you there? When was the last time your mentor did that? That's really, really important. Something to consider, right? Your mentor in anything. It could be, you could be a civil engineer, you know? So yeah, that's something to think about. Kendall said, it's been a minute. How's life out of residency been? It's been good. It's most definitely better. It's so much better than residency. However, studying for the boards has just been, it's been crushing me. It's like, I'm trying to get 10 hours of personalized studying on top of our 2 to 3 hour case presentation that we usually do Sunday nights. We took off this week because we did one Wednesday and we did last Sunday. So we did 2 last week and we're going to be doing 2 more towards the end. It's just a lot. Adding on 10 to 15 hours of board studying, it's a lot. It's a lot to try and squeeze in. It really is. So did you ever buy your Cybertruck? No, I didn't. I'll tell you what, if I pass boards, I'm getting that Cybertruck. I'm putting my foot down. By then, hopefully I'll be able to afford it. I'm also tough on like payments right now. I don't have money. I don't have money to put towards that right now. And maybe I will after holidays, after the holidays. And I just bought like $2,000 worth of Christmas presents today. Cyber weekend discounts. Yeah, seriously. And I just don't have money for it right now. So I got to try and save a little bit if I can, because a lot of these expenses have been tacking up these first 6 months out. And what else? Yeah. So if I pass the boards, I'm going to do it. I'm going to pull the trigger. I'm going to do it. I'm going to get it wrapped in a glossy black. I think it'll be a safe commuting vehicle, clean too, as well, because it's electric. But yeah, I'm going to do that. If I pass the boards, I'm going to do it. I'm doing it. I'm putting my foot down. I'm doing it. So, but yeah, Kendall, thanks for asking that. I really appreciate that. So, Kendall, shout out to you on the podcast. I'm recording this for the podcast I'll put out. It's TikTok Live number 86. So I'll be giving you a shout out, Kendall. Thank you. Bam02 said, I was wondering because I heard surgery can thin out bone even more. Mine is thin due to camo orthodontics. Oh, I gotcha. And let that orthodontics heal. You know what I mean? Maybe that's what the bone loss is from. Fountain 75. What's the worst part about private practice? Best part? Worst part about private practice? I don't know. Maybe scope. You could always expand your scope. You get your hospital privileges. You take call. You bring patients to the hospital. You do surgeries there. Best part about private practice is you have an opportunity potentially to become an owner or a partner. When you become owner or partner, you can make your own rules. You only want to work 3-4 days a week. And you're the owner, you go and work 3 and 4 days a week. You can get some tax deductions as an owner. You make more money, right? Because you're the owner now, but you also bear the grunt of you're the owner. All the responsibilities are on your shoulder. All the problems are on your shoulder. I'm excited to deal with those problems though. I'm excited to lead a team. I really want to be a partner. That's my number one goal. And we'll see if we get there. So Jay Wells said root canal treatment. Yeah, I saw that. Ethan said, I'm interested in medicine. Oh, we did that already. Jfcjdbddj said, wholeheartedly agree. Thanks, man. Jfcjdbddj said, hey, have you thought about talking with Dr. Stuckey, Everyday Oral Surgery, on your podcast? I did. I sent him a DM literally like a year and a half ago. I think it was a year ago. It was like 13, 14 months ago after Amos meeting, and I never heard back. Yeah, I need help. Someone help me contact Dr. Stuckey. I'd like to, or maybe he just doesn't want to talk to me. I don't know. _._.s. Did you find it annoying at all, or is it so satisfying to be the last resort for complications? It could be annoying. Sure, it can be annoying if it's something that could have been prevented and it's really affecting the patient. Yeah, that's just sad. That's too bad. And we did see that a lot. I saw that a lot in residency. It's unfortunate. And unfortunately, I think with the direction of dentistry, where a lot more general dentists are doing more specialized treatments, because of the squeeze that insurance is putting dentistry in through right now. I think that's only going to happen more, unfortunately. Joey, aka Homelander, said it's 217, by the way. The root tip's at 217? I think you should be okay. I think you should be okay. We will see. Jessica Ranwalia 599 said, is it true that dentistry is not what it used to be? Seems to be a lot of negativity online. Unfortunately, the insurance is crushing all of healthcare. That's the truth. That's the fact. That's what's going on. And I'm hopeful, but it's going to take a lot of revision. And no one's really talking about what revisions are necessary in order to change the direction of where dentistry is going. So we will see. Joey, aka Homelander, said, fair enough. J Wills 927 said, have you ever placed a pterygoid or zygomatic implant? Yep. Yes, I have. Jessica Ranwalia 599, follow the live creator. Thanks, Jessica. Ron. Thank you. Carissa said, I don't have any suggestions right now. I'll ask the OMFS club at my school and get back to you. Carissa, let me know. Let me know. Do I have you on Instagram, Carissa? Send me it. And I'm so far behind in DMs, guys. And I don't think I'm going to be able to catch up with that stuff until maybe I get some time off around the holidays. I don't know what time off I had. I only had off Thanksgiving last week, and that wasn't enough. I'm a couple months behind on the DM requests, so I'm sorry about that. I will get to it though. It just might not be until after boards. I think February, March is going to be big time on catching up on the DMs. Okay, Carissa said, did your fiance finally make the move? Is the dog coming after boards? She hasn't made the move yet. That'll be in the next couple months, I hope. And dog will be sometime after boards as well, for sure. Yeah, I got to pass these boards first. Yeah. Thanks for asking that, though, Carissa. Yeah, soon. Chris Patel 344 said, "Do you know anything about the correlation between mouthwash and high blood pressure?" Yeah, I don't know if I agree with that. I think that's a very, very far fetched, and in the pathway kind of makes sense, but I don't think that's related at all. I don't. I just don't think. I think you need to look at the study, the subjects of the study before you can really link high blood pressure to mouthwash. I really think, and I get it. I totally get it. I just think it's too far. I think it's too far and few between actually causing systemic changes in your systemic hypertension to the oral cavity, the oral biome. And here's the thing. I'm such a supporter of these new naturopathic and holistic ways of looking at dentistry and medicine as a whole. I love asking questions. I love the fact that research is being done to look into these things. But I think a lot more needs to be done before we can conclusively say that mouthwash is a link to high blood pressure. You know what I mean? I think we have to look at those subjects and like, what other comorbidities did they have? What other medical history did they have? What other things were they doing? Were they exercising? What is their diet like? How old were they? What was the age range of these subjects? You see what I'm saying? There's a lot more questions that I need to know the answer to before I can agree with that correlation. _dot_s said, "Are hospital privileges optional?" Not for boards. For board certification and to take the board exams, they're not optional. You need to have that. It's required just to register for that exam. 927, do you administer Precedex? I don't do Precedex in private practice, but I would. It's such a smooth sedation. It's a really good idea to use that. And I would if I could. Christopher Madero said, "Thanks for the content. Been watching from D1. Now I'm making my rank list for OMFS." Chris, let me know, man, and congrats. Thanks for watching the content. Let me know how I can help you with your rank list for OMFS. There's a lot of things to consider going into that. I know. Sergio Hernandez, bro, said, "To be a dentist or go into IT?" That's a huge difference. I don't know. If you go into IT, would it be remote? If you go into IT, do you know what specialty within IT you go into? I got a buddy, future brother. He's in cybersecurity. He's a whiz at it. He's awesome. And he's got such a good position at his job. He goes in, I think, 2 times a week. I think that's pretty sweet, but it could be very different. Earning potential. What do you want to do if you own your own IT company? I think that would be a hack, but it depends on what you want to do. Looney Tunes said, "Can't do post-bac and masters, low GPA because of CCP in high school, but 4.0 in uni, 20 in the DAT. If I retake, is it good?" You could retake it. I would apply right now. Can't do a post-bac. Don't do a post-bac. Go apply, get some good letters of recommendation, and apply to dental school. That would be my recommendation. Ishan Kapoor said, I'm wrapping it up right now, guys. Bjorn just got the number 3 gift badge. Cool. What's up, Bjorn? I love that name. I love the name Bjorn. Ishan Kapoor said, "Did you ever have a time you wanted to switch from dental?" I don't know. Tony, what is the longest surgery that you've done? Maybe 15, 20 hours. Yeah, cancer surgeries can go a long time, especially if you're doing a flap and it's all combined. Yeah, those are really long surgeries. Jessica Ronwalia 9599. Do you think the situation of dentistry is the same as the US versus Canada? I'm Canadian. Nope. I think it's different. I think it's very different between the US and Canada. I think it's very, very different. I just saw an article where 1.59, just yesterday, 1.59 million Canadians were in the emergency room and left without even getting treatment in the year of 2024. That's not good. Guys, what's going on in Canada? That's not good. We do not want to mimic Canada's situation. Bjorn, should I pull out my wisdom tooth if it's sideways, or is there anything else I can do? You can't make a judgment on that based off of just that alone. I would need to see x-rays. I would need to see my clinical evaluation of the tooth. I'd want to get a history of it. I need to know where the inferior nerve is. Before taking out a wisdom tooth, you need to know all these things. Where's the nerve? What's the clinical presentation? What's the radiographic analysis? Do you have a CBCT if showing the 3-dimensional radiographic imaging if it's near the nerve? Things like that, right? Or is it completely erupted? It's functional and you could adequately clean it. Then I can't recommend taking out that wisdom tooth if it's asymptomatic. You see what I mean? There's so many different things in evaluating wisdom teeth before you make a recommendation. Underscore dot underscore dot S said, is it hard networking with local dentists? I mean, I just go to their office and say hello. Sometimes I call ahead. Sometimes I DM them. Sometimes like I just go for it. You know what I mean? Is it hard? No, no, I don't think it's hard. It depends on them too. You know, are they willing to? Some of them, it's like so hard to reach them. So it's very variable. Caspian said, is ortho worth it? Yeah, I think ortho's worth it. I definitely think ortho's very competitive though. Orthodontics as a specialty is one of the most competitive specialties along with oral surgery. Orthodontics and oral surgery are the two most competitive specialties in dentistry from my experiences, and I know a lot of others would agree with that. Those two are very, very challenging to get into. Sergio Hernandez Bro said, hygiene right now. The market with insurance sounds hectic and questionable ROI with dental school. Okay, gotcha. Zoe underscore Valis said, where should a student receive mentorship if their dental school doesn't have OMFS faculty? Nearest oral surgery program. I would try going there and talking to someone in administration or the faculty there. That's one thing. Otherwise, what about your local town where you grew up? Zoe, you should reach out to an oral surgeon there. See if you could shadow. See if you could reach them. They would be great mentors if they're willing to do it. And if they're not willing to let you shadow and reach out, then you know they're not going to be a good mentor. So don't go there. You know what I mean? That's where I would start with that. J Wills 927. If you went to med school, what specialty do you think you would have done? I'm glad I didn't go to med school, and I'm glad I'm not in that predicament. And I don't know. Anesthesia seems like a sweet lifestyle. Orthopedics looks really good. Orthopedic surgery. Yeah, I don't know though. I don't know. Bjorn said, got you. Thanks. You got it, Bjorn. All right, guys. Last couple of Krish Patel 344 said, have you seen how wisdom teeth have stem cells which can help rebuild damaged tissue? I'm all for research on stem cells. I'd like to see results of these and complications of these first before I make any recommendations or use for that. You know what I mean? All right, guys, that's it. TikTok Live number 86. Thank you so much for coming on. I'm going to be giving you guys the top 5 listeners on this TikTok Live, 86. I'm going to be giving you guys a shout out in the caption of the podcast and YouTube. And I'll see you guys next week. All right, let's make it a great week. Let's finish. Let's get a good night's sleep. Let's begin early tomorrow. I'm going to go eat dinner now, and we'll go from there. But guys, thanks so much for coming on. Love you guys, part of the podcast family. Yeah, thank you guys. You have a great week. Okay, I hope you had a good Thanksgiving. Spend time with family, and I'll talk to you soon. All right, guys. Good night.